Good morning. My name is Marshanna Smith, and I'm the Public Information Officer for the Jackson County Executive's Office. On behalf of my fellow colleagues in Johnson County, Kansas, and the Unified Government of Wyandotte County, KCK, thank you for being here today. And thank you to the Unified Government for hosting us at Memorial Hall for today's press conference. The three jurisdictions of Jackson County, Missouri, Johnson County, Kansas, and Wyandotte County, Kansas are here today to announce they have coordinated their individual stay-at-home expiration dates with the intention of reopening uniformly. Each jurisdiction continues to work on their respective reopening plans. Therefore, details of those plans will not be discussed today. But the coordinated effort today will result in many commonalities of each plan. Each jurisdiction will provide an avenue in which to share their plans at the appropriate time they see fit, along with any additional resources for the public. Here today is Bridget Schaefer, Director, Jackson County Health Department, Dr. Sanmi Areola, Director, Johnson County Department of Health and Environment, Dr. Alan Greiner, Unified Government Chief Medical Officer, Jackson County Executive Frank White Jr., Chairman Ed Eilert, Johnson County Board of County Commissioners, and Unified Government Mayor and CEO David Alvey. Following our speakers today, there will be a brief time for questions and answers. I'll turn it over now to Dr. Greiner. Thank you.
Good morning. Thank you for being here. I'm Dr. Alan Greiner, G-R-E-I-N-E-R, and I'm the Chief Medical Officer here at the Unified Government of Wyandotte County, Kansas. We are here today to describe a cooperative and coordinated effort that is happening across the Kansas City metro area to extend our stay-at-home order. The rationale for this extension is based on data and the conditions we're seeing in the community with COVID-19. We believe at this point we have passed the curve, the peak of the curve of deaths and hospitalizations, but we know we will continue to see our community suffer from this disease. So with caution, we will begin moving forward after we stop the stay-at-home order at midnight on May 10th. We want to be cautious and careful. Our county, Wyandotte County, has been the hardest hit by COVID-19 in the metropolitan area. We are working hard to protect the vulnerable segments of our population, as our partners are in Johnson County and Jackson County. We're making progress, but we're not in the clear yet. We will all be moving into a phased approach of reopening after May 10th. There's no vaccine or effective proven treatments for COVID-19, and we know we need to expand our testing and the contact tracing work that we are all engaged in. By finding individuals that need to quarantine over the long term, we believe we can control the disease and prevent another spike that stresses our healthcare system and affects our vulnerable groups. It is possible that if transmission worsens, we could have to move backwards in a phase or zone. But we will all be watching the data together and working to make those decisions. The important thing is keeping our community safe and encouraging everyone to cooperate in the efforts that we know can reduce spread. So moving forward, data will be crucial, testing will be crucial, contact tracing, and everyone's involvement in making the decisions and behaviors that can make a difference. We believe that each zone will need to last a full 14-day incubation period of the virus, and that we'll need to follow the data during that time to make each decision about moving forward. We will continue to promote social distancing and personal hygiene efforts at every step. And we will know that there will be fewer and fewer restrictions if the numbers and impact of the virus goes down over time. We believe that we will be able to return to much more normal activities in the near future. But it is possible that over time, we will still need to practice many of these new behaviors into the summer, into next fall, and possibly into next winter. We will continue pushing for testing and tracing, and when it is safe, we will proceed to each new zone in our plans. The goal is to move forward step by step and not compromise or endanger the health of our citizens. Thank you for being here. I will now turn it over to Dr. Somni Areola.
Good morning, Dr. Somni Areola, S-A-N-M-I-A-R-E-O-L-A. I'm the director for the Johnson County Department of Health and Environment. When I moved here to take up this job about 5 weeks ago, one of the first things that stood out to me was the public health leadership in the region. We don't have walls around our cities. We don't have walls around our counties. It's very important that we do this collaboratively, and it's been very impressive to see public health officers, medical directors, elected officials working together to address and curtail the impact of this pandemic on our citizens. The second thing that I noticed was the steps that were taken were timely. One of the first things I did was attend a similar event like this with the health directors and elected officials, putting shelter in place protocol in the region. That was timely, that was adequate and very appropriate. And it's the reason why we are even talking about rolling back some things. And for the public, for those of you that have cooperated, we thank you. I think it's very important that the cooperation is why we are where we are. We made some gains. We did not overwhelm our hospital capacity. We minimized the impact. We didn't see what we have seen in other places in terms of the adverse consequences of exposure to this virus. But there's a lot of work to do moving forward. What we don't want to do is take our feet off of the pedal. We don't want to lose the gains that we have made. And so moving forward, we have our gating criteria, but we are pitching our effort on two things. One, on ability to conduct robust surveillance, adequate testing, and like Dr. Greiner said, the second part, our primary tool becomes contact tracing. And what that means is when we test and we identify people that are positive, we use our public health tool of identifying their contacts and putting them in quarantine so that we form a wall around them and they don't go around spreading that. And so moving forward, we're going to have spikes. Hopefully we don't have a massive spread. And that would, again, depend on you doing the right things, washing your hands frequently, and when in between hand wash, use hand sanitizers when that's possible, keeping a 6 feet distance from people, and just doing the stuff that we have been saying. Avoiding large crowds so you are not too close to people. I know it's a disruption in our normal way of life. We love to hug, we love to shake hands, we love to be in the midst of people, but we're asking that you, because of these times, that you stay away from those things. with your cooperation and your help, if you do what you have done the past 5 to 6 weeks, we would win against this virus. Thank you for what you do. Keep doing this, and we appreciate your cooperation. Thank you.
Good morning. I'm Jackson County Executive Frank White Jr. Over a month ago, we stood together and announced unprecedented restrictions as we moved and do business and the way we live in the presence of this deadly coronavirus in our community. We knew these stay-at-home orders would not be easy, but it was necessary to save lives in many of our communities. Today, we can say that due to these orders and tremendous sacrifices that have been made by so many in our communities, that we have saved lives. Unfortunately, despite these dramatic measures, we still have lost at least 124 people in the metro area. When you think about how deadly this virus really is, you only have to think about the national numbers. When you have over 1.1 million cases to date, when you have over 63,000 deaths in 2 months, when you're getting 30,000 new cases nationally every day, it tells you how deadly this virus really is. Our thoughts and prayers are with those who have lost family and friends during this pandemic. We know that this is especially hard on you, and your loved ones will not be forgotten. That is why it's so important to remember that the fight against COVID-19 is not over. COVID-19 is still in our community. Our future is in our hands, and how we move forward depends on the community. Today we stand united again in our commitment to reopen our communities in a smart and safer way, knowing that when we work together, we're stronger, we're better, and we're capable of overcoming any challenge we face. As such, I'm announcing today that I plan to begin Phase 1 of the reopening of Jackson County, Missouri on May the 11th, in alignment with Wyandotte County and Johnson County. While I will not be releasing the entirety of our plan today, I can tell you our plan will largely mirror the many components of the plans announced by my counterparts this week. In addition, I'm asking for input from the community, from our residents, about how safe they feel during certain activities, and what precautions would make them feel comfortable engaging in those activities safely. So later today, you can go to jacksongov.org and take a brief survey answering a few simple questions to help us finalize our plan. So again, we're not here today to go through those details of our plan, but each jurisdiction has aligned their reopening plans to the maximum extent possible to minimize the confusion by residents of our communities. Before I conclude, I would like to thank our healthcare workers and first responders who are in the forefront of this fight, and they are truly heroes. I'd also like to thank our residents for complying to our orders to keep our community safe. You've done an amazing job. And I must commend Mayor Alvey, Chairman Eilert. I had great respect for them before this collaboration, but it has grown so much in a short period of time. Both are dedicated public servants who I trust and am proud to call friends. I look forward to continuing to work with each of you and others across the region in the days, weeks, and months ahead. Remember, our best days are ahead of us. We will emerge stronger, better, and more united than ever. Thank you.
Thank you. Good morning. My name is Ed Eilert, E-I-L-E-R-T. I'm chairman of the board of the Johnson County Commission. Thank you all for being here today. It is our opportunity to join with the leadership of Jackson, Wyandotte County to continue the process of reopening the economies of each of our counties. It has been a difficult time for all of us. And I want to recognize the challenges, the difficulties, and the sacrifices that have been made by each one of our community members. It has been a challenge for all of us. As we go forward, it's important that we take steps to minimize the opportunity for community transmission and continued spread of the virus across the metro area. We hope that these efforts that we have engaged in and cooperated and announced today of extending the stay-at-home order until May 11 puts us in a position to minimize the opportunity for the spread to continue, to spike, and to put us in a position in the future that none of us want to be. So I thank the leadership of Jackson County, Wyandotte County, the public health medical directors who have made this decision to cooperate and to make sure that we can move forward, opening our economies, opening our businesses, and offering the best opportunity to minimize the continued spread of the virus. The governor of Kansas yesterday evening announced a plan for the state of Kansas. We will be reviewing that plan. Previously, about a week ago, 10 days ago, Johnson County put together a task force to review steps for opening our economy. And I would say this, there are many similarities between the governor's plan and the task force plan. There are some minor differences, but I anticipate that we will move forward even with those minor differences with the governor's plan. So we're asking your continued cooperation, your continued commitment to making our communities safe, to minimize the impact of the virus. We have been able to do that because of your cooperation. We need that continued cooperation so that our numbers can continue to go down and we can continue to move forward opening our businesses. I want to say a special thank you also to the first responders, our healthcare workers who put their health at risk on our behalf in meeting the health emergencies of our community. We would not be in the positive place we are today without their commitment. So thank you very much. All of us owe them a debt of gratitude. As we move forward, there will probably be other decisions, but we think it's important to coordinate and work together for the maximum benefit to all of our communities. Thank you very much.
Good morning. My name is David Alvey. I am the Mayor, CEO of the Unified Government of Wyandotte County, Kansas City, Kansas, and my last name is spelled A-L-V-E-Y. I first want to offer my sincere condolences on behalf of the people of Wyandotte County to those families who have lost a loved one to COVID-19. I ask each one of us to honor them by protecting ourselves, our loved ones, our employees, our customers, our fellow workers from infection with COVID. I also offer my support to each one of us who is suffering emotional and financial hardship due to the battle against the spread of COVID-19. We are committed to finding the right balance of preventing the spread of the virus while also steadily relaxing the stringent measures that were implemented across 90% of our nation so that we can get back to business. We believe we are winning this battle, but we also know that COVID-19 is highly transmissible and highly lethal, and we must be constantly vigilant. Today we gather at Memorial Hall. Memorial Hall was erected to remember and to honor those individuals in our county who made the ultimate sacrifice in defense of their nation. Memorial Hall was built in the period after the First World War. That was an exceptionally lethal conflict worldwide. U.S. forces entered the war late in the conflict, but yet 53,000 American servicemen and women died in battle. Each one of those persons was precious to their loved ones, to their families, to their businesses, to their farms, to their communities. And so it was entirely fitting to remember each of their lives as precious here in a memorial. Yet, as proper and fitting as this memorial is to honor those who fought and died in battle, it would be just as proper and fitting to honor the 45,000 servicemen and women who died from the Spanish flu epidemic of 1918 and 1919. Nearly as many servicemen and women died from the Spanish flu while in service as died in battle. Their names are not listed here, yet each one of them was precious to their loved ones. Each one of them made the ultimate sacrifice for their fellow Americans. So we are engaged today in a battle against a new enemy, literally, novel coronavirus. And we are making our own painful sacrifices in this battle. And just as in a land or sea battle, one must watch the enemy. Must watch the enemy to determine their position, to ascertain their strength, their movements. So too, we must watch COVID-19. We must ascertain where it is, how strong it is, how it is moving. And just as in battle on the field, a soldier must look to his officers for their leadership to protect them and to press the attack on the enemy. So in this battle against COVID-19, we must look to our public health officers. We depend on their training, their experience, but most importantly, on their commitment to the common good to lead us in this battle. So I wish to commend the public health officials of Jackson, Johnson, and Wyandotte counties for their commitment to defend the precious lives and livelihoods of all of our citizens. And I wish to commend Chairman Eilert and Chief Executive Frank White and every elected official who follows their public health officials and provides them with the resources that they will need to fight this battle on our behalf. Again, I want to thank all of you for being here today, and we will now accept questions.
I'll go first then. Last month, you all had the Core 4. Today there's only 3 of the Core 4. Why is Kansas City, Missouri not here? Or why are they not coordinating with you all? What kind of talks have you had with that city?
So throughout this, we've been in conversation with Kansas City, Missouri, and certainly with their public health department. And that was really, again, under the leadership of Dr. Greiner and Dr. Arioli and Bridget Schaefer and Rex Archer. They were talking together. I'm not sure why they decided to announce on Wednesday, but that was a decision made within Kansas City, Missouri. Certainly, there was no decision on our part to exclude Kansas City, Missouri.
have a question for all the counties. Oh, I'm sorry.
We're going to get answers to.
I'm sorry.
Answers coming here.
When Kansas City announced their plan, that caught everybody a little off guard. And what Mayor Albee and Chairman Otter and we've been discussing all along is we had so many different dates. And we wanted to try to come to a date that would just cut down the confusion of people. I know we originally was at the 15th, they were at the 3rd, and we talked to our health officials to come up with a date that they thought would be comfortable for us to work with. And that came out to be the 10th, starting on the 11th. And so since Kansas City had already announced, then that kind of put us where we are today.
I have a question for all the counties. I know you didn't discuss the details of each of your plans, but when it comes to businesses, how are you going to police that? Are you going to warn them or issue tickets or fines? How does that work?
In Johnson County, in the past weeks of the stay-at-home orders, our emphasis has been on education. And many times, whether it's a city police officer or a county sheriff's deputy, going out, visiting with the business person or the individual, explaining to them what the recommendations and requirements are, there's been compliance. So, to my knowledge, there's been no ability, and it's not our intent to issue citations or anything like that, but to focus on the education and asking for their cooperation.
Is there a mechanism in place in case they do not reply if they refuse?
Well, there is, but we've not had to use that at all. So, thank you.
So I believe the question was specifically about religious services, worship services, those questions. And again, I think different plans may have slight differences to them. Our plan is available on our wycokck.org website. But I believe all across the country and in our metro as well, most of the decision making will be based on the concept of social distancing. So we know we're going to have new social norms as well. We need people to be wearing face masks like we're all doing here today. We need people to social distance unless they live in the same household with a group of individuals that they're near. But in any facility or building, we're going to want people to maintain that spacing as much as possible, and we'll go in phases or in zones where we allow a certain small number in a facility or worship space, and then after a couple of weeks, if our data is still looking reasonable and hasn't started to go in the wrong direction, we'll increase those numbers and keep moving that way. Some people in some places are looking at things like square footage. In our plan, we don't do that, but we talk specifically about smaller spaces, larger spaces, and those kind of things. We think people can do this and be careful. We've already shown with what we've had to go through in the last month that we can make a big difference. And I think if people continue focusing on caution and safety and contributing to the public's health, we'll continue to move forward. Yes, the question was basically how do we know in the public health arena that we're not moving too soon, and how would we handle things if we had to reverse course? Obviously, this is a novel virus. We're learning new things every day, and changing our approaches and plans on the fly. We're really seeing that across the entire world. But many of us in the public health world have been pleasantly surprised at the impact we've seen in the last month on data, on the number of hospitalizations, on the number of cases, on the number of deaths. We were extremely concerned 6 weeks ago that our healthcare systems would become completely overwhelmed, as we've seen happen in other parts of the world and even in parts of the United States. We were able to prevent that and stabilize things. If that goes the wrong direction, of course it will be difficult, and we'll be asking people to make extreme sacrifices to go from gradually reopening to moving backwards. But we've got to protect health and life, and our most vulnerable citizens with this virus are the ones that are most likely to be severely affected. So we've got to keep working together and watch that data closely, and we'll continue to do it on a daily, if not hourly basis moving forward. I think we have some confidence, but we're very cautious.
Are there going to be any ongoing restrictions for the most vulnerable, as you were saying, in the nursing homes? That seems to be the most dangerous spot.
Yes, in fact, that's, for instance, in the Wyandotte County Restart Whiteco plan, we specifically draw out long-term care facilities, congregated care facilities, and provide special guidelines for those facilities in terms of disinfecting, personal protective equipment, tracing, those kinds of things, because they are the most vulnerable. And in Wyandotte County, as you know, we've had at the Riverbend facility and Life Care, we had very serious outbreaks that resulted in many deaths. So those require special attention.
In Johnson County, the task force order or recommendations and the governor's program outlined last night both speak to long-term care issues. And our public health department is in constant communication with our long-term care facilities, working with them, holding webinars, advising them. And we have done a lot of work and a lot of testing in our long-term care facilities, and that will continue.
If there are no more questions, we thank you so much for being here this morning. Again, each jurisdiction will be putting out plans regarding their respective reopening plans as they see fit. So continue to look for that information in the coming days on Jackson County, Johnson County, and Wyandotte County's websites, Facebook pages, and any other mediums to get that information out to the public. Again, thank you so much for being here, and have a good day.